Hello, and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We'll be speaking with Professor Moshe Szyf this morning, founder and CEO of HKG Epitherapeutics. He's going to discuss epigenetic research, the company's novel tools for early detection of cancer, and promoting healthy aging. Some recent data published about the company's proprietary epiCervix that detects cervical cancer in patients sooner, and a bit more. Welcome to Health Professional Radio, Professor Szyf. Thank you so much for joining us.
Thank you.
Tell us a bit about yourself and how you came to found HKG Epitherapeutics.
I was working on DNA methylation, which is the main epigenetic mechanism, for more than 4 decades. Around 15 years ago, we started a collaboration trying to understand whether DNA methylation could be used for early detection of liver cancer. Mm-hmm. And since liver cancer is a disease that is a pandemic, really, or endemic in China, we did this study in China, and through this study, we found out not only the power of DNA methylation to allow us detection of cancer in blood, liver cancer in blood, but also that we should be able to detect any cancer in blood using that method. And around 2016, I decided it's time to translate the research from the bench to what we call the bedside, to use it for the benefit of the population, and to try and develop a whole panel of early detection markers using the science of epigenetics. And let me also explain what is the science of epigenetics. Epigenetics is the way our DNA is punctuated. We inherit the DNA from our ancestors. That cannot be changed. But what we learned is that what happens to us in our life is rewriting the punctuation marks on the DNA, and that can cause disease. And therefore, by mapping and understanding that, you should be able to detect and prevent disease.
Now, you said based on things that happen in your life. We're talking environmental influences, correct?
Yes, but in a very broad sense. You know, we always think about environment as just toxic air or something like that. But environment could be, and we showed that, the social environment. Your boss, your mother, your family, your relationships. Environment includes everything we live in, the animals around us, the microbes around us, the people around us. And they all write punctuation marks in our DNA and affect the way our DNA works, and of course affect the way of our well-being as well as disease.
If we can use this method to detect cancer or some cancers earlier, is it also used in, I guess, longevity research as well? If we get rid of cancer, obviously longevity would be improved.
Of course, cancer is, one major block on longevity, but there are other diseases like cardiovascular diseases. But we learned also in the last decade that we have a clock in our body and actually in our DNA that works on the same mechanism, on epigenetic mechanism. And it ticks, from 0 to 100 throughout our life. And the average is similar to the average lifespan, but some people have a clock that ticks faster and they will die faster, and others have a clock that ticks slower and they will live longer. So this DNA biological clock is becoming extremely interesting as an instrument for us to assess, which interventions that we're doing might extend our lifespan or shorten it. And because DNA methylation is not fixed, it is changing, as we said, with environment, with experience, with exposures. This clock can move at different pace at different times in our life. And it could offer for us a very exquisite way to understand the fundamentals of our body and try to improve it.
Now, it's my understanding that the International Journal of Cancer recently published some new data on the ability of your proprietary epiCervix test to detect cervical cancer in patients sooner compared to the traditional screening methods. Elaborate a bit on this study briefly and what it means for the industry and patients.
Right. So, we have reasonably good methods for following and detection of people at risk to develop cervical cancer, namely measuring HPV, viral infections with HPV, and also some pathological assessment of cells in pap smears. However, the sensitivity of these methods is not very high. That means not everybody that has HPV or even a pre-malignant pathology would have cancer. On the other hand, we might miss those that have cancers using these methods. So our method is looking at cancer DNA within the sample. And since we are using new methods of next generation sequencing and looking at this special profile of epigenetics of the DNA that is cancerous, we can detect cancer DNA in samples that otherwise would have gone as not cancerous. And that means that we can detect that cancer earlier, which means that we can save many more lives.
What other tests does HKG offer, and how are they beneficial to patients?
Right. At this stage, we are offering the biological aging test that we spoke about. The EpiLiver test is for liver cancer. We just completed a study in Bangladesh that was very successful, and we published it. And we also are now offering a pan-cancer test, which means it's a test that can detect around 33 different kinds of cancers, and it serves as like the first red flag to be followed by more specific cancer tests. We believe that tools like this will have a huge impact on reducing morbidity and mortality from cancer, and as well as reducing the cost to society of treating late cancer patients.
What else do you have planned for HKG this year? And give us a website where we can learn more.
What we're building now, we want to build a platform that could detect any disease, essentially, not just cancer. Our eyes are towards mental health disease as well as cardiovascular disease, diabetes, and other diseases that register in the DNA and therefore could be detected by the same method. Our platform could easily be adjusted to detect many, many different kinds of disease that involve the same technology. And so the big challenge is to translate, research level processes to clinical level processes, making it robust, making it high throughput, making it automated. And we are building a complete automated system to be able to deliver across the world epigenetic tests.
And a website where we can learn more about HKG Epitherapeutics.
So our website is like our name. It's www.HKGEpitherapeutics.com.
Professor, I thank you for lending us some of your time this morning. Hopefully you'll return as things progress at HKG. Thank you so much.
Thank you so much. Bye-bye.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Professor Moshe Szyf. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.